How do you know when you need to replace your
Like,
veneers? It's a good question. How do you know when to replace breast implants? You probably know the answer to this because it's pretty common knowledge. 10, 15 years. Anything you put in your body tries to break it down. But with veneers, what happens is your gums are constantly receding at a, sometimes at a rapid pace, sometimes at a slow pace. Gum recession can be affected by your bite is probably the #1 cause of gum recession, whereas people will say periodontal disease. Periodontal disease really has to do with bone loss, which then typically, in most cases, the gum will recede in health with the bone. Now, not in health, you'll have these big whatever, it doesn't matter. So why would you replace veneers? #1, your gums recede a little bit typically every year, and after 15 or 20 years, you'll start to see the margin of the white veneer against the root of your natural tooth with the gum receded, and it'll look like a brown gap. And so people say, what's the brown on top of my veneers? Now, the other thing that happens as the gum recedes up, it also recedes in all the pink triangles. As those recede in, if you don't prepare the tooth properly, it's called an interproximal elbow, and hide that margin of the veneer, as that tissue starts to recede, you'll start to see interproximally dark. And so a patient will smile and say, it looks dark after 5 years. That's improper preparation or improper hygiene. And then there's a margin. Anytime you do any restoration in a patient's mouth, you're preparing a margin for the restoration to seat. Why we take so much time and effort in getting a clean impression, because we have to capture those margins to give to the lab, and then we have all of this digital technology and all these fancy ceramists that have to, under microscope, find our margins and trim them so that they can put them on the ceramist's table to then build the veneers right to that margin. And then when you go to insert it, you've got to make sure that it's clear and clean and the path of insertion is correct and that restoration seats right up against that margin. If it doesn't, it creates a gap. And if there is a gap at time of bonding, it's more likely to leak and get bacteria in between the margin and the veneer, and it will start to decay the tooth. Now, if you have open margins, does that mean you're going to have rotten teeth? No. Then there is another criteria based on the patient's hygiene. I've seen people with amazing diet, great hygiene, tons of open margins that have no decay in their mouth. I've seen patients with tiny, minute, little, tiny open margins, and they have crappy hygiene and a crappy diet, and their mouth is full of cavities. So again, there is no, we have to give generalizations based on work. And if you're not basing your answers on work that you yourself have seen, it's the same thing as just quoting someone else's discoveries, which you don't know to be true unless you actually live through them yourself. You understand what I'm saying?
Yeah.
That's why there's so many differing opinions in medicine. Why do I replace veneers? I have conversations with my patients when I think that there's too much recession, they don't look good, and they're starting to get corrosive margins or leaking margins. We replace them, and that usually happens around 15 to 20 years. I've seen it happen in 10, and I've seen it happen in 30. It just depends on the patient.